PIPS, Personalized Information Platform for Life and Health Services. Isomol, sorbitol, herbal extracts 1%, E150A coloring, menthol, aspartame 0.07 grams per 100 grams, AC sulfame K 0.05 grams per 100 grams, phenylalanine 990 kilojoules amounting to 230. Are you wondering what this incomprehensible list is? It's just candy. How many times have we read or received information without being able to make heads or tails of it? And which of these do we really need? PIPS is a suite of personal services designed to encourage more informed individual choices, to improve one's health and quality of life, and to control and prevent diseases. The basic idea behind it is very simple: providing people with useful, understandable, personalized information selected according to their needs and preferences. Nowadays, a great deal of information is already available online, from canned tomatoes to specific medicines, with their expiration dates, directions, ingredients, manufacturer. Along with this data, in PIPS we also find personal information about dietary or ethical preferences, which each of us can enter. There's also information that one's personal doctor can enter about the patient, such as the diet or treatment he needs to follow, or any possible allergies. Basically, one's complete profile. This way, it's possible to know if this candy is compatible with one's diet or the medications to be taken, or even if there are simply certain aspects that don't agree with our personal tastes or opinions. PIPS proposes one of the simplest, most immediate ways to stay healthy, carrying out common everyday activities in the right way. For example, everyone knows that walking is good for you, but how long should you walk, and how? PIPS knows. A personalized program informs the user and involves him in carrying it out. PIPS is also tailored for each age. Children can learn to stay healthy and enjoy doing it too. Thanks to its personalization, simplicity, and technology, PIPS helps us protect our health in our everyday lives. Here are some examples. In this way, PIPS helps us in our everyday choices, even at the supermarket, where the common shopping cart isn't the same anymore. Thanks to wireless technology, even this cart is constantly linked to PIPS. All you need to do is identify yourself with your card, and all the relevant information required will immediately appear on the screen, including your shopping list, diet, and recipes. PIPS uses advanced technology capable of collecting all the information on our candy by way of the barcode or the innovative radio frequency tag, which communicates with the cart in real time. Just place the product in the cart, and PIPS checks whether the product selected is suitable for our personal profile, indicating interactions, allergies, opinions, and preferences, while giving suggestions that are in line with our needs and can help us improve our lifestyle. The same service can also be obtained by using a common mobile phone. At this point, the decision is ours. We can freely decide whether or not to follow the indication and advice provided by PIPS. It's important to emphasize that the information we receive and send remains between PIPS and us. Only we and our doctors are granted access to our profiles. In the case of health conditions that require constant monitoring, such as heart problems, PIPS is capable of gathering and programming the necessary information for controlling one's health status directly at home. For this purpose, we can use a scale and other medical devices with wireless technology. Once the measurements are taken, the information is sent automatically to the PIPS system, which stores it in a personal file. Another easy way is to make a note of one's health conditions and send them by text message. If the system requires more information, the user is asked to log on to the PIPS portal through the internet and fill out a questionnaire. PIPS actively selects the questions based on the patient's answers. The system makes an assessment and tries to determine the person's conditions. If further verifications are needed, it asks for measurements of other parameters of the user's health condition. Even when there isn't a computer around, information can still be sent thanks to a digital pen and a common Bluetooth mobile. But how? The digital pen recognizes and memorizes what's written on a special piece of paper and sends the data recorded to PIPS by way of mobile phone. Once the questionnaire is completed, the system is activated and sends messages indicating the patient's condition or practical advice for immediate action, and activates the prescriptions prepared by the doctor in advance. PIPS alerts the patient that the treatment has been changed and also notifies the doctor, who can then check and certify the new treatment for the patient. One aspect not to be underestimated is that the PIPS analysis helps doctors provide the appropriate answers more quickly. Thanks to PIPS, the medicine cabinet becomes an innovative tool to stay healthy. When we take a box of medicine out of the cabinet, an antenna identifies the product and sends the information to PIPS. Immediately appearing on the cabinet's touchscreen is information such as, "This medicine is okay." "Warning, this medicine has expired." Or, "This medicine is not compatible with the other medications you are taking." The screen also provides access to a personalized version of the multimedial package insert. But there's more. PIPS also reminds us of the medications to be taken and helps us make sure we're properly following the treatment prescribed. It allows for the accurate management of our supplies and makes suggestions on how to store it properly. Have you almost run out of a medication, or are you wondering if you should buy a new one? PIPS shows you the nearest pharmacies to make the task easier. PIPS even takes care of us in the kitchen by recommending recipes that are appropriate for our diets and compatible with our profiles. We can check on the ingredients, the nutritional information, and the method of preparation with illustrative videos. And if we like a recipe, PIPS even helps us write the shopping list. Physical activity is important for your health. So PIPS has designed a personalized walking program adaptable to everyone. What's needed? A wireless pedometer and a mobile phone with the PIPS application. With these tools, it's possible, among other things, to set a personal goal. In this case, complete 10,000 steps within a certain amount of time and at the right pace. But it doesn't mean you need to change your lifestyle. Instead, going out to buy the newspaper or walking the dog become integral parts of the program, and the results are available instantly. PIPS isn't limited to monitoring. For example, it sends personalized messages congratulating users when they complete a program or encouraging them to improve. You can't reach your walking target? PIPS asks why and makes suggestions. Thanks to the initial profile and the daily diary, the suggestions will be tailored to the user's characteristics. The doctor's always available and checks the program on the web portal, an essential service for those who need to perform monitored physical activity. Walking with PIPS is the best way to keep on the path to health. PIPS is targeted to children too, teaching them about health and prevention through playful activities and animation. Here's our friend Jumpy 5. Hey Jumpy, would you like to explain what you do?
That's easy! I teach kids to eat better with lots of fruits and vegetables.
And how do you do that?
Simple! The teacher uses books to explain the main things. What antioxidants are, which fruits are seasonal, the importance of colors. Then I come in with special classwork, a team video game where children learn how to completely balance their diet. Understand recipes and nutritional information. And remember the 5 rules of wellness.
Hey, you're in a classroom, remember? Is this any time to jump?
Of course! Why do you think I'm called Jumpy 5? It's because I jump around and my video games make kids use their minds and bodies too. Because children should always get lots of physical activity.
Well, Jumpy, have fun then. Bye!
Bye!
With Jumpy 5, PIPS teaches children prevention in a fun, effective way. Because you never forget what you learned through playing. Then the fun continues at home, where children can share the right recipes with adults for a healthy, balanced diet. To summarize, portal, cart, mobile phone, wireless monitoring, pedometer, smart cabinet, doctor, educational games. And at the center of it all, the individual. PIPS, the personal doctor in your hand.